6 months ago today, the World Health Organization got the first reports of a cluster of cases of an unknown pneumonia. Fast forward to today, after a global lockdown and 500,000 people dead of COVID-19, the WHO is now warning the pandemic is speeding up and the worst may yet be to come. But there is progress being made finding a vaccine. So joining me now is infectious disease specialist Dr. Abdu Sharkawy. Doctor, great to talk to you this morning. Those are pretty dire words, and the WHO is meeting again this week. What is the priority right now?
I think the priority hasn't really changed. The priority should be that, restrictive measures in terms of people trying to distance as much as possible, reinforcing the message of hand hygiene, and doing whatever possible to ramp up testing capacity and contact tracing is still critical. And the examples that we've seen in the United States in particular really highlight the importance of making sure that restrictions are not lifted too quickly. That's a really devastating picture that is being that is unfolding there, and it's a very serious cautionary tale for the rest of the world to take note of.
Doctor, today is the last day of the first half of 2020. China's military has approval to use a new COVID-19 vaccine after clinical trials showed it was safe. That same vaccine has been approved for human testing here in Canada. And though it's not the only vaccine that's being tested, talk to me about where we stand where it comes to vaccine research, because for a layman like myself, it seems like it's moving pretty quickly.
It certainly is moving pretty quickly. It's actually moving at a fairly unprecedented clip. And that's because, there's a tremendous amount of collaboration going on. And in the case of the Oxford vaccine, for example, they had a bit of a leg up on the rest of the crowd because there was testing done based on other coronaviruses about a year ago, both in an animal model and on human volunteers. And so we've been able to sort of fast track things in a number of areas here to move to further stages of development sooner than otherwise would be the case. This is an exciting area, but I want to temper expectations that this is something that is going to help us to prevent future waves. It's not something that's going to be able to stem the tide of what's happening right now. No matter how quickly you work, there's no way that this is going to be executable and rolled out on a mass scale in the next few weeks or even in the next month or two.
Well, I want to ask this when we're hearing about another possible new flu virus with pandemic potential that could be passed from pigs to humans. Are we looking at another global pandemic? Is this the new normal?
Oh, boy. I mean, I think we all held our collective breath when we heard reports of that surfacing from China. If nothing else, I think this is a reminder that, viruses are literally ubiquitous, that, the agro industry and the way in which we use animals and produce, what we have for consumers to consume things in their diet really needs to be re-examined. And more than anything else, all of the steps we're taking right now to try and prevent transmission of COVID-19, we have to continue doing that. These are going to be permanent changes in our attitudes, I hope, towards transmissible diseases. And I hope we don't lose sight of that.
Doctor, I want to sneak in one last question because this morning you tweeted this photo. It's a note from Niccolo Foligno, who's 9, and it says, quote, "Dear the world, COVID-19 will soon end because every time something gets started at a certain time, it will end, and that will never change." You come on this show and you give us really important, sometimes hard news to hear. Why did you want to start the day with that note of optimism?
Well, it brought me hope, and it brought me back to the idea that, even though this is a bit of a new challenge for us, it's not going to change the paradigm of infectious diseases altogether. This will end one day. It's going to take a tremendous amount of work and a tremendous amount of investment and accountability from everyone in our society, whether it's decision makers and policymakers or average people. And I think if we hold fast to that and remember that we need to support one another, we're going to get through this. And I just found that note from young Nicola just so heartening, and it gave me some hope, and I wanted to share that with everyone else.
Doctor, you've got an incredible job and a hard job every day. We appreciate you taking time to come talk to us.
Thanks so much, man.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.